Thank you so much. I'm absolutely thrilled to be here and to tell you a little bit about what we do. So imagine a future where rather than medicating severe diseases and injuries, we could cure them. Imagine rather than reaching for pills from the pharmacy, we reached for cells, living medicines, the building blocks of our body. And if those cells weren't functioning absolutely correctly, we could take them into the clean room in the laboratory and educate them to do their job better. That's what my team and I do every day, working toward curing different diseases. I started my career 30 years ago, not ashamed to admit it, 30 years ago, working on something called bubble baby disease. This is technically adenosine deaminase deficiency, if you want to get scientific. It's some of you may be old enough, as am I, to remember a movie called The Boy in the Plastic Bubble with John Travolta. That was about that disease. So the babies are born with no immune system. They need to stay basically in isolation. Their moms reach into them through plastic gloves. They have no immune system. They can't be outdoors or see other kids or even be hugged. 30 years ago, we started by taking the baby's cord blood stem cells as soon as they were born. The cord blood contains hematopoietic stem cells. These are the stem cells of the blood-forming system. Taking them into the laboratory, using a viral vector that was gutted and just contained the gene of interest, a good copy of the gene that was broken in the children's blood cells. Putting that gene into those cord blood stem cells, returning those to the babies. At first, it worked okay. And then we just kept at it for 15 years. And now, 50 children have been functionally cured. They're on no medication. They've had either their cord blood or bone marrow stem cells taken to a clean room facility, the good copy of the broken gene added to their stem cells, reinfused back into the children or young kids, and those stem cells make corrected blood cells, corrected immune cells for the rest of the lifetime of the children. And so we've had 10 years follow-up now on the most successful therapies, and we do call that a cure. Here at UC Davis, we're working on many variations of that therapy using people's bone marrow or mobilized peripheral blood. We can get the bone marrow stem cells to come out into the circulation and capture them through apheresis. We're very fortunate to have a large, good manufacturing practice facility at our institute in Sacramento. That's a large clean room facility where we bring the patient's blood or bone marrow cells or other types of cells. We bring them into the clean room facility and change them in some way. And so for those cells, blood-forming stem cells, we are treating things like sickle cell anemia. And again, after the cells are transplanted back into the patient, they will continue to make the corrected blood cells for the lifetime of the patient. So we're working on many cures with those type of stem cells. But I wanted to talk about one other type of therapy that we're doing. Imagine getting a diagnosis that you've relapsed from cancer was not as horrifying as it is right now. We are working with CAR T cells, which Chancellor May had mentioned for HIV. These are chimeric antigen receptor modified T cells. We take T lymphocytes from the patient's bloodstream, thanks to our apheresis in our cancer center. We bring them into the good manufacturing practice facility, and we add a gene that will put a new receptor, a new antenna on the surface of those cells. So I said that we can take the cells, the building blocks in, and modify them if they're not doing their job well enough. Well, the patient relapsed from their cancer because those T cells were not seeing the cancer. Somehow the cancer became invisible to their entire immune system. Cancers are good at hiding. We engineer the patient's own T cells to have a new receptor that we know will find that tumor, that cancer. We then take the cells back in our STEM mobile, which is a modified golf cart, take it back over to the cancer center, reinfuse them into the patients. they go through the patient's body and seek and destroy those cancers. So for leukemia and lymphoma, this is now up to 95% cure rate for relapsed patients. We're working on many solid tumors. This is the future. I'm so glad and humbled to be here at UC Davis, be able, for the last 15 years, be able to work toward therapies like this, make a real impact in our patients' lives, and to really use our robotic bioreactors in a good manufacturing practice facility to change people's cells to do a better job and not have to rely on all those pills in the pharmacy. I'm a 10-year cancer survivor, and this is very near and dear to my heart. As of last month, it was 10 years, so yay. Thank you. Thank you. Really glad to be here and just glad to help other patients. So that's all I have, very short, but thank you so much. Thank you for being here.